The body goes through an aging process, so the composition of all of our tissues change as we age. Hi, I'm Dr. Maitra with OrthoCarolina, and I practice at the Gastonia and Belmont locations.
My name is Cheryl Fix. I am the Director of Operations for Orthopedic Urgent Cares and Strategic Projects here at OrthoCarolina. So acute injuries, they are clinically defined as injuries that have occurred within the past 6 weeks or up to 3 months. They are injuries that tend to have a definitive moment in time where you've sustained injury. Sometimes it can be from a traumatic injury such as a fall, tripping over an animal at home. It can also be from playing sports. You hear things like ACL tears. Those are examples of acute injuries, so things that are technically occurring within the past 6 weeks and they had a definitive moment for their onset.
In particular, as we get older, we find that we get stiffer. And that's really due to the change in the composition in the cells in our muscles, our collagen, cartilage. The makeup of all of these tissues change with their structure, and they're more at risk of breakdown with activity, particularly with joints. So the cartilage tends to wear out over time just from the natural aging process. Key symptoms that we see patients with include joint swelling and joint mechanical symptoms. So what I mean by that, joint clicks, gives way, buckles, gets stuck. Those are mechanical symptoms that probably need and deserve an evaluation. Swelling and pain that can't be controlled. That's another good measure to get patients into their orthopedist office for an evaluation.
Some examples of acute injuries include things like ACL tears, femur fracture. Other examples of acute injuries can also include distal biceps tendon ruptures. You may have heard the term Popeye deformity, and that alludes back to the cartoon where Popeye had a unique looking bicep, and that's an example of that type of injury and its presentation.
Stiffness is another progressive process that also prevents patients from participating in their activities that probably deserves an evaluation. And it's a process that, while we try to modulate and control, we can't reverse. Some patients get to the end of the road after being treated with conservative measures that ultimately need a major joint replacement. With the advancements in technology, patients now can control their own appointment scheduling, and they can make appointments on their own time to see providers who they want to see or in locations that they want to see. I think patient scheduling online can be a very effective way to meet the patient's goals, so they can bring care to the patient rather than having patients come for their care.
As far as injury, it really depends on what is best for you as the patient, depending on the intensity of your pain, the duration of time that you've been experiencing symptoms. The orthopedic urgent cares might be a great option to you in providing access for you to get that quality, excellent care here at OrthoCarolina. In the event this is something where the urgent care is not the option you would like to go based on the hours or locations for them, you always have the option to schedule online with one of our healthcare practitioners.